Hello, everyone. We are going to just briefly talk a little bit about nutrition during pregnancy and highlight some of those key components that we would want to educate women on. So, as women are going through their pregnancy and essentially creating life, we know how that is going to call for an increased demand of energy. So, nutritional needs translate into energy needs. So, on the slide here, you can see that ideally we want women to take in roughly about 300 calories extra per day, or a total caloric intake of 2,500 calories to meet those increased needs associated with pregnancy. From your ATI, they also talked about in the second trimester increasing those calorie needs by 340 calories per day. And in that third trimester, increasing calories roughly about by like 452 per day. So I did want to encompass those to help you guys prepare for your ATI exams as well. Now, there are a lot of things that can be harmful to pregnancy, and we call these teratogens, whether it's medication, certain foods. So we do want to make sure that we're involving that education with women. So you can see quite a few different things listed on the slide. So I'm just going to hit a couple of them. Ideally, we do want women to kind of restrict their caffeine amount. So if you are one of those women who can still tolerate coffee during your pregnancy, and that is something that you just feel like you can't live without, I always tell women that's totally fine to still have your coffee in the morning. Even if you're a Starbucks person and you want your latte, as long as you keep it to that one latte, totally fine. Ideally, we just want to keep it to that 300 milligrams per day or less. Other things are going to be things like your soft unpasteurized cheeses and your cold cuts. These can have a bacteria called listeria in them, or listeriosis. So we do want to try to avoid that. So ideally, if a woman is craving some like a Subway sandwich, what I always tell them is, hey, that's totally fine. Just like make sure they run it through that toaster twice, because heating up that meat will help kill off any of that bacteria. If they're at home, make sure they put it over the stove and they're killing off that bacteria by heating it over the stove, or if they're wanting to put it in the microwave. So yes, they can still have it, but just try to heat up that meat first to kill off that bacteria. Alcoholic beverages, you know that this can lead to fetal alcohol syndrome. So we're going to want to educate on that. And then different fish can have higher mercury content. So big ones that they're going to want to stay away from are things like the mackerel and the swordfish. This slide is just covering some prenatal vitamin information and mineral recommendations. So we do want to make sure that women are taking a prenatal vitamin every day. And we want to make sure that that prenatal vitamin has folic acid in it. The amount ideally of folic acid that we want that prenatal to have is about 400 micrograms. Ideally, we want women to be taking 400 micrograms of folic acid daily. This is going to help prevent neural tube defects. If they have a history of having a child with a neural tube defect, then we're going to actually up that to 800 micrograms. So that's why you can see that 0.4 to 0.8 is because if they had that history of a child with neural tube defects, we're going to just up it to 800 micrograms. Keep in mind that physiologic anemia of pregnancy, or that pseudoanemia, occurs just because of that increased plasma volume, and that leads to dilution of that hemoglobin. So just know with normal pregnancy, that hemoglobin is roughly around 11 to 12. Make sure that women are taking in a good amount of fluids, and then they're also increasing their amount of protein and iron that they're taking in through their diet, as well as with their vitamins that they're taking. So making sure that we can educate them on good sources of protein and iron from like spinach and chicken and all other items that they could consume. Because ideally, remember, we want them to be getting these nutrients from foods more so than the vitamins if they're able to. Other vitamins that we're going to talk about and minerals are going to be things like calcium. You can see the daily recommendation is roughly 1,000 milligrams per day. For us that live in these northern territories, sometimes our vitamin D can get pretty low, especially in the winter. So making sure that we are educating on vitamin D supplements and making sure that they're reaching their daily value with that. And then you can see omega-3 fatty acids, vitamin A, vitamin C, and then again, just reminding women to take in a good amount of fluids. Roughly 2 to 3 liters of fluid per day is what we want them to achieve. This slide is just covering prenatal vitamins and talks a little bit about the action and why they're important and when we want them to take them. So ideally, it would be great if they're able to start taking these 10 weeks prior to conception. And then we want them to continue this throughout their pregnancy as well as during the times that they're breastfeeding. Again, reminding them that that folic acid is really important. So making sure that that is part of the prenatal and making sure that they're looking at the ingredients to make sure that folic acid is incorporated in it. Otherwise, we would have them purchase folic acid separately if they do want to continue with that certain prenatal vitamin. That folic acid, again, is going to prevent megaloblastic anemia in the pregnant person, as well as those neural tube defects that we had talked about prior. They should be taking a prenatal vitamin once daily. Again, if they are having some nausea or anything with this, then we could have them take it at bedtime to help just prevent that nausea from occurring, since they'd be resting when that nausea would possibly kick in, or just to make sure to take it with like a food or orange juice to not only help with absorption, but to also help with that nausea as well. Other things that we're going to want to hit with them is that these can be purchased over the counter. There are a variety of different kinds. So again, just educating them on what we would expect to see within that prenatal vitamin, just making sure that they don't exceed the recommended dose, and stick it in a place to where they are going to remember to take it every day. So maybe by their toothbrush. So that way they can remember to take it either at bedtime or in the morning when they're brushing their teeth. We do expect women to gain weight throughout their pregnancy. Depending on their BMI is going to dictate how much weight we want them to gain with this pregnancy. So if they are underweight with a BMI less than 18.5, we are going to want them to gain roughly 28 to 40 pounds with this pregnancy. If they have a normal BMI, ranging from that 18.5 to 24.9, then we want them to gain roughly 25 to 35 pounds. If they're overweight with a BMI of 25 to 29.9, sorry, there's a typo there. So again, overweight BMI 25 to 29.9, then we're only going to want them to gain 15 to 25 pounds. For somebody that's considered obese in that category of having a BMI greater than 30, we're going to have them gain 11 to 20 pounds. So remember to educate women that that weight gain is going to occur from both that fetal development or fetal growth and the accumulation of maternal stores. So roughly what we would see is a patient gaining 1.5 pounds per month during that first trimester, and then a pound per week during the last 2 trimesters. With women that are in that category of having a BMI greater than 30 or obese, we do want to talk to them a little bit about the increased health risks associated for both mom and baby because of their obesity during pregnancy. They are at an increased risk for gestational diabetes mellitus. This is typically, we screen women around that 26 to 28 weeks gestation. However, for women that have a good amount of risk factors or who are considered obese, we're going to test for that gestational diabetes earlier on in pregnancy, just so we can really get their blood sugars under control and try our best to reduce reduce some of those risks and side effects associated with gestational diabetes. The mother is also at an increased risk for preeclampsia, and we're going to learn more about this throughout this quarter. This is where they're having like a high blood pressure that can lead to a variety of different symptoms and complications. This condition can affect the entire body, you guys, from the kidneys to liver failure, and it can even result in seizures, which we call eclampsia. So letting women know that we do want to work with them as best as we can to kind of manage their weight during pregnancy. And again, kind of keeping to that recommendation of weight gain that we had talked about on the previous slide as well. But these are things that we would monitor in those women that do have that BMI greater than 30. Some dietary risk factors and complications. So just be familiar with the different factors that can be involved with, people being able to meet those nutritional needs with pregnancy. So think about age, think about culture, education, and socioeconomic factors. So when we think about teenagers, I don't know about you guys, but when I was in high school, I did not have the greatest diet. So if we're dealing with like 16, 17, 18-year-olds, or even a little bit older in the college years, they might not have the best nutrition. They might not be getting all the vitamins that we would want them to be taking in and a good amount of protein. And oftentimes they might forget about taking those prenatal vitamins and iron supplements. So making sure that we're working with them and helping them understand the importance of having that healthy diet and making sure to be taking those prenatals on a regular basis. Vegetarians. So vegetarians might have a decreased intake of protein, as well as calcium, iron, zinc, and vitamin B6. So we want to make sure to work with vegetarians, find some food items that work with their lifestyle and their life choices, and make sure that they're consuming a good amount of items that can meet those needs. And also making sure that they stay on top of their vitamins as well to kind of help boost those areas they might be lacking in. Nausea and vomiting can affect pregnancy and can affect their ability to take in food. It can affect, like we talked about, them having nausea when they take their prenatal vitamins. So those are things that we want to ask about and see if we can come up with some strategies to help combat some nausea and vomiting during pregnancy. Anemia. So if they have anemia, then we're going to want to discuss some, different food items that they can incorporate in their diet to help boost those iron levels in addition to taking supplements. Eating disorders, anorexia and bulimia. So people that have a history of eating disorders are probably going to have a lot of anxiety with pregnancy because there is that weight gain factor. So making sure that we're working closely with these individuals. We might even have them kind of meet with a dietitian or working with like a mental health professional to kind of work through this process and make sure that they're still getting the nutrients and taking their vitamins and gaining the proper amount of weight that we would expect, but also meeting those mental health aspects that could be affecting them and causing them anxiety with that standard weight gain that we see with pregnancy. There's also a eating disorder called pica. Hopefully you guys remember us kind of highlighting this in mental health. And this is where women might crave some non-food substances, such as like dirt or clay or ice. Usually this can be related to anemia. So once we get that anemia under control, we can see some of those symptoms with pica start to resolve on their own, but making sure that we are asking questions and looking into this. And then are there other factors that are impacting their ability to even just like purchase or get access to quality foods? So if they are stressing about not being able to afford to buy the food that they need, and that is going to help them have a healthy pregnancy, maybe we could look at programs like WIC. for them. So kind of keeping those resources in mind so that way we can really help these women have a successful and healthy pregnancy. You can see on the other portion of the slide, we talk about maternal PKU. This is a maternal genetic disease in which high levels of phenylalanine pose a danger to the fetus. It can cause intellectual disability, behavioral problems. So for this patient, we would want them to kind of resume that PKU diet for at least 3 months prior to pregnancy and continue throughout the pregnancy. Those phenylalanine levels are monitored during the pregnancy. And then the other thing that we wanted to hit on is the diabetes mellitus. So both pre-existing and gestational diabetes are going to be complications that are going to require some nutritional interventions. So we're going to have to talk to them about getting in a good amount of exercise, monitoring their amount of carbohydrates in their diet, trying their best to keep those glucose levels within that target range, and then making sure that they're doing their best to limit those sweets and desserts that, because those can be really high in carbs and sugars. And we'll probably set up a couple times for them to meet with a registered dietitian so they can talk about healthy meal plans and ways that they can kind of keep those blood glucose levels within that target range that we discussed with them in clinic. Nutrition during lactation. So when we are breastfeeding, it's important to increase that energy. It's going to take in more. It's going to have a higher demand of energy, right? So they're going to need to increase their caloric intake roughly by 500 calories more in a day. So making sure women are aware of that compared to non-pregnant women. So making sure to have that extra 500 calories. Women should be taking that prenatal during their breastfeeding times. And then just reminding them of those other, factors of, hey, we don't want you really smoking. We don't want you consuming alcohol and having excessive caffeine when you are breastfeeding, because these things can still have an impact and get into the breast milk. So letting women know to kind of keep those things under control doesn't mean that they can't have any alcohol at all, but making sure that they limit it and time it properly with breastfeeding as well. So this slide is just kind of recapping some of those things that we're going to want to highlight with women for a healthy pregnancy. So again, just starting early with prenatal care and maintaining their regular visits. So that way we can just monitor their pregnancy and continue those educational aspects, making sure that they avoid smoking and drinking during their pregnancy, as well as during breastfeeding, like we just talked about. Taking a prenatal vitamin that has 400 micrograms of folic acid in it. Again, for those women that have a history of having a child with a neural tube defect, we'll up that to 800. Making sure that women are getting plenty of rest and adequate exercise, as well as plenty of fluids. Again, that 2 to 3 liters per day is going to be ideal for them. Eating a nutritional diet that's going to help them take in all those nutrients as best as they can with food versus just relying on their prenatal vitamins to get those vitamins. Making sure that they're wearing a seatbelt at all times, and then spending time with their family and discussing the physical and emotional changes that happen with pregnancy, and making sure that they're aware of some of the changes that they could see, for instance, in their children, and how bringing in a new child can impact the family, both in positive and maybe some ways where a child could be going through regression. So just having all those conversations, there's a lot of education involved with this big change in their life. So we're wanting to hit all those topics so they feel really prepared for those changes to occur. And then the last thing that I wanted to hit on is HG, so hyperemesis gravidarum. This is when women experience excessive nausea and vomiting during pregnancy, to the point to where they're losing weight and they're having volume depletion. So this is pretty pretty miserable for these patients. Oftentimes, they're coming in to get IV fluids and IV medications to just try to get their nausea and vomiting under control and keep their electrolytes imbalanced, or keep their electrolytes balanced, excuse me. This can occur in approximately 2% of all pregnancies. We don't really fully understand the causes, but we feel like there are certain things that could play into this. One of them is hormonal changes. So the increased levels of that HCG and estrogen, we feel like are playing a role with this increase in nausea and vomiting. Also, the changes in the GI system. So progesterone helps relax certain muscles, right? We talked about that with the menstrual cycle. Well, one of the muscles that it might also relax is that esophageal sphincter, and then that can increase GERD symptoms. Genetics could also play a role with this. So we do know that there's an increased risk when there's a family history of HG. And then in your readings, it talks about them kind of finding some two different genes, the GDF15 and IGFB7, that were identifying could be possibly linked with HG as well, which is really interesting. Our last slide here is just comparing the differences between like your morning sickness as well as your HG. So again, one of the big factors, you guys, is going to be somebody losing weight. So you can see with HG, you lose 5 to 20 pounds or more. So it's really hard for you to actually like maintain and have weight gain when you're experiencing HG. Whereas with morning sickness, you're not losing any weight. Some other big differences is that a lot of the times you're going to need fluid hydration, like IV hydration, as well as IV medications. Whereas with morning sickness, kind of like dietary and lifestyle changes are enough to kind of help manage your symptoms and help you feel better. With morning sickness, usually after first trimester, you are feeling better. Whereas with HG, you usually feel better, kind of somewhat better, I should say, by mid-pregnancy, but you can continue to have nausea and vomiting all the way up until late pregnancy. And then the other factors are like with morning sickness, most of the time you're able to like get through your day-to-day activities, go to work, and kind of like be fine. With HG, you're not able to do that. Like it's to the point to where you can't really get to work. You can't function most days. You even need some assistance to help like take care of yourself. So HG can have a really negative impact on pregnancies. So again, we want to do what we can to help manage those symptoms as best as we can for these patients to try to help them overcome this HG and kind of work through it. So that's all we have for this nutritional topics with pregnancy. Again, if you have any questions related to this content, feel free to reach out to Lindsay or myself, or you can bring your questions to class and we can make sure to get those answered for you. All right. Thank you.